Welcome to the HIT Podcast, H.I.T, Human Resources, Insurance, and Technology. I'm your host, Toby Kennedy. As we do every week, we're dropping in your feed on Tuesdays with bite-sized, digestible, well-curated conversations going on in the space. This week's episode will be no exception. This week's episode is brought to you by Montage Insurance Solutions. And without any further ado, I bring in my buddy Nick. Nick, what's going on? How are you?
Hey, Toby, nice to see you. Thanks for having me on today. My name's Nick Buratti. I'm with Allied Benefit Systems. We're the nation's largest independent TPA and looking forward to our conversation today.
Yeah, that's a great conversation starter right there because that's exactly what I wanted to talk about today. So, kind of in the health insurance world, you obviously have your fully insured products, and that stuff's all pretty straightforward. And more employers look to explore self-insuring, self-funding. And when you do that, you can kind of baby step it and you just go right to the insurance carrier and you put everything with them and you just say, I'm going to own my claims liability, Cigna or Aetna or whatever. And, you kind of bundle all ASO, and it's getting you into the world of self-funding, but there's so many more levers that someone can pull and so much more control. And so sometimes when groups really look to kind of unbundle everything, there becomes a part of the ecosystem where a good TPA fits right in there. And so what I kind of want you to explain, maybe broadly speaking, where does a TPA fit in with what group and when, and kind of what do you guys do? And if I was a benefits manager out there looking to explore this and wanted to coach myself up so that I had my sea legs surrounding this topic, help me out here.
Absolutely, absolutely. So, Toby, let's kind of start with the first point there. What is a TPA? So, TPA is really a professional organization. Works better if it's an independent organization. We'll talk about what that means in a second. That's really responsible to be kind of the CPA of your health plan. So, we're processing claims, we're doing member services, we're kind of that end user platform, oftentimes that front-facing technology that members look and feel similar to an insurance company, but ultimately we're not an insurance company. So really what we're focused on is kind of creating that member experience, that the processing of claims in the manner to which the employer wants us to, and how they dictate, their benefits through their summary plan description. That's really from a high level what we do and who we are.
Yeah, I like that explanation. I've heard it sort of described as like the connective tissue almost, right? Where as an
Right.
employer, you've worked with your broker consultant and said, hey, we want to go self-insured, and we'll work with the broker to secure some version of stop loss, right? Which we've talked about on the show before, maybe individual and or aggregate stop loss that says, hey, look, Mr. and Mrs. Employer, if your claims hit these certain predetermined thresholds, the stop loss will perform. But along the way, there's lots of little claims. There's all the rolled ankles, there's all the, prescriptions, there's all the babies that are being born, all the things that happen kind of throughout the plan year. And, the providers of care need to know, are we going to get paid, and literally getting them paid and making sure they're paid appropriate so the employer is not paying too much. I think that kind of connective tissue analogy I've thought is a decent one.
Absolutely. Absolutely. I totally agree with you there. And, going back to the fundamental model of, self-funding, fully insured, right? Fully insured, you don't get to see anything behind the curtain. You don't really get to know what's going on. You get very, very brief notes on the highest claimants of your plan. If you were to think about any other industry or anything else going on, if you were to make a very, very large purchase and not get any type of receipt or detail on what that purchase entailed, what was being bought, and just saw dollars deducted from your account, you'd go crazy, right? If you go to the grocery store, you spend or you purchase or you pick up about, let's say a bag of groceries, you think it's going to be $100, right? And then the cashier goes and says, hey, you owe me 1,000. You're going to go ballistic, Toby, right?
You
You're
want to,
going to
well,
be
which one of these items got so expensive? They're, no, we're just telling you in aggregate, you owe us 1,000. Like, well, can
right.
I strip out the
Exactly.
steak, or is it the bottle of
Exactly.
wine? Up, none of your business. Just give me the money.
I didn't buy the Wagyu today. I didn't buy the Kobe beef. I didn't buy anything crazy, but that's the problem. That's what goes, that's what's, I would say, a little bit wrong with healthcare today, right? A lot of it is that billing and how it works and not how, everybody doesn't really understand it. And that's a way that TPA can bring value to you, right? We're working with the providers, we're working with the networks, we're making sure that when your members go and get services done, those services are being rendered, that, things are getting billed appropriately, coded appropriately, so that your employer knows what they're paying for. So transparency is going to be I would say, a big point that we'll talk about today, and one of the key factors to why you should consider this model.
Yeah, well, and that's because if you're fully insured with Anthem, for example, when you go to the doctor, you give them your card, they call Anthem. And that's the phone number on the back. And Anthem says, yeah, no, this guy's covered. Go ahead and see them, right? When you remove the insurance carrier from the equation, you need someone to pick up the phone when the provider says, hey, John walked into my office and would like to be seen, and I'm not seeing him unless I know I'm going to get paid. So, you guys, to start with, just to talk about the various roles you play, you literally field those eligibility inquiries, right?
We do. We do. Now it depends on the network, but yes, we certainly can, amongst some of our networks, field that eligibility piece, right? That's step one, making sure that the member, when they go to the provider, of course, they're qualified to get coverage. And then, of course, depending on what they're trying to get, it makes sense, right? You don't
And then
want
that service
running around.
happens, and that
Yep,
service is something, right? I don't know. Maybe, like I said, that you went in for a cold or something, right? So now someone needs to facilitate that provider getting paid the contractual amount, and someone needs to dip into the pot of the employer's bucket of money they've set aside for claims, and someone needs to ensure the doctor's being paid for what was rendered, right? The guy went in for the sniffles. You're not gonna, send that doctor what they would earn for delivering a baby type of thing, right? You got to look at the code,
100%.
read the code, and send the right stuff.
We're checking the code, right? Toby, I'll use a similar example, right? You go and you get your tire changed, but all of a sudden, that's the service that was being rendered, but all of a sudden you get a bill for a new engine on your
Right.
car. That doesn't make any sense, right?
Right.
You need checks and balances in place to make sure that you're being billed appropriately and that the services are being rendered are what's being paid for. And that's what we do. That's the
Right.
beauty.
And so you guys are, this is just some of the things you do, but these are the things that you guys do when an employer says, I would like to decouple even further from the insurance carrier. Because again, you could go ASO or administrative services only and tell Cigna, Aetna, et cetera, UHC, hey, listen, we want to own our claims, but we do want to engage you for everything else, right? That's an option. Now, some employers choose not to do that and again enter the TPA. When and where and why do employers make that decision not to just engage the insurance company for all this stuff? Why would I engage someone else?
Yeah, I would say, another consultant I work with, she told me one of the ways that she always explains to her clients is, you don't want the fox watching the hen house. And what she means by that is, the insurance carrier, they have priorities in a lot of different places, right? We're not going to pick on an individual insurance carrier, but also known as the BUCAs. They have allegiance to their providers because they have networks, right? They have service agreements, they have utilization requirements, they have contracts in place with all those networks, right? So they're in allegiance with the providers. But they also have clients, right? And they're supposed to be watching their clients' dollars, but ultimately, when they have their contracts with providers, things can get a little bit convoluted, right? You, TPA, at least an independent TPA, like the organization I work for, our allegiance is to our client.
Allied, we
Obviously,
can name
there's,
check Allied. They're giving
yeah,
you, of your time today. You're showing up.
absolutely, absolutely. So I work for Allied, and Allied is an independent TPA. I mean, we're not insurance company owned. There are TPAs that are insurance company owned, but we are not. So our autonomy is with our clients. And when a client wants more transparency, B, more insight into why things are getting paid, how things are getting paid, making sure that, their dollars are being watched with a lot of scrutiny. That's when they use us. That's when they use a TPA because, like I said, our allegiance is to our client. It's not to the provider contracts. It's not to an insurance company. Obviously, we have to follow their rules, but ultimately, when push comes to shove, you have that large dollar claim. If there's a way that we can save money, but also make the member's life better throughout the entire healthcare journey there, we're going to do it, right? We're not just trying to drive utilization to a specific provider. There's no incentive for us to do that. Our incentive is to support the client in every way that we can so that we retain them year over year. That's really the
And
difference.
for me, a little bit of like Fox henhouse analogy, I think it comes into play also on the pharmaceutical side, right? And so a lot of people maybe don't know, but behind the scenes, you've got everything we just discussed on the medical side. And then the kind of connective tissue on the pharmacy side is the PBM, or the pharmacy benefit manager, right? They're the ones saying, all right, you went to the pharmacist, we need to bill the plan, we need to issue the script, we need to pay, all the things going on. And what I think is really relevant is that the insurance carriers have sort of absorbed, vertically aligned, own the major PBMs in this space. And so they're sort of happy to bill your plan for an expensive drug, because they're buying the expensive drug from themselves, right? They're their
Right.
own customer,
Right.
and so they're sending it to you, and to the self-insured, the ASO client. So another reason why I've seen groups enjoy unbundling further from that ASO model is to say, not only will I have a TPA who can really watch the bills that are hitting my plan spend, but I can also decouple from the big three PBMs and maybe go find someone that's a little smarter, sharper, faster, watching this stuff with aligned
Right.
incentives. And that's
Right.
something that you guys saddle up right next to, right? Those kind of independent PBMs also, if a group wanted.
Absolutely. Toby, great point there. And pharmacy now, if you'd asked me 3 years ago, I would have said probably about 30% of your spend, but it's getting closer and closer to that 50, 60% mark. So you really do need to watch those dollars. When you're working with a large insurance carrier or kind of in that bundled setting, they're going to do everything they can to align with their preferred PBM, which, oh, by the way, is generally a PBM that either they own or the PBM owns them, right? So it's really important to, look at that flexibility, try to find the best possible deal for your client. My organization works with over 55 PBMs in the marketplace today. So that just really does give your consultant the ability to be an architect. So you get to decide how you want to build your home, your health plan.
Yeah. So you, the plan sponsor, and you sit with a consultant, you really pull this stuff apart. You go, all right, we're going to look for the stop loss. We're going to look for the PBM, and then we're going to have, a good TPA kind of serve as the engine room to kind of connect all this stuff. I think maybe one last piece I'd like to touch on is the way that you can put downward pressure on claims, including the visibility and the data and the stuff that you guys provide, where you say, hey, look, we're not only processing all your claims, but we're throwing them into cool graphs and charts that you get to have a look at as well.
Absolutely. So we actually are, since we're the one processing claims and housing that data, we actually can deliver that right back to the client 24 hours, 7 days a week, where you can see almost live claims reporting every single line that's going through your plan. Not that you're going to be sitting by a computer every day and looking through that, but that's what our team's for. That's what your consultant team's for. They're going to be looking at the data, identifying trends so that when we see things coming, because we have 15,000 clients across the country, process billions and billions of dollars worth of claims. We know when trends are coming. They're programmed into our algorithms within our claim system. When we can get in front of something, whether it be a cancer, diabetes, chronic condition that you're seeing on your high cost claim report that you're getting from your fully insured carrier, and there's like nothing we can do, that's what we want to get in front of. That's what we want to deliver to you. We want to provide you with solutions, not just increases with no explanation around them. So that's really the value of a TPA.
Yeah, I appreciate that. And I appreciate you shedding some light for me here. As you know, the premise of the show, we try to keep this bite-sized, digestible. Before we get out, if an audience member was watching and was trying to leave today with a decent education, a coaching up on kind of what a TPA is, how they fit in, anything else you'd want to make sure we get out on that we touch on?
I would say if you're an employer out there or a consultant out there that's looking for transparency, looking for more control, and then looking for flexibility and the ability to really create your own product, create your own solution and deliver out in the marketplace, that's when you call an independent TPA. We want you to be the architects of your employer's health plan, and we want you to build that dream home for all members to utilize comfortably, but also financially responsibly.
Cool. Nick, I appreciate you so much, man. Thank you so much for joining us, and thank you guys for watching. That's all the time we have on this week's episode. Thank you to our sponsors, Rula, Excel Health, TrueHue, Montage Insurance Solutions, the guys that keep the lights on. Thank you guys for joining every week. Watch the numbers going up and up, so we appreciate you. Join us next week. Join us every week. And until next week, make this the best week yet.